Hi, this just appeared on my Twitter. It's from Medical Express. Largest COVID-19 contact tracing finds children key to spread. Evidence of super spreaders. Evidence of super spreaders. So this has been written by Morgan Kelly at Princeton University, top university. So, what do we have here under such a title? A study of more than 500,000 people in India who were exposed to the novel coronavirus SARS-CoV-2 or COVID-19 suggests that the virus' continued spread is driven by only a small percentage of those who become infected. So, only a small percentage of the people who become infected with the virus are carrying it. Perhaps that's because the PCR test is totally defunct and the majority of people who are found positive of having the virus asymptomatic actually were fighting off a common cold. Furthermore, children and young adults were found to be potentially, this is the key word here, potentially, much more important to transmitting the virus, especially within households, than previous studies have identified, according to a paper by researchers from the United States and India, published September 30th in Journal Science. Researchers from Princeton Environmental Institute, Johns Hopkins University and University of California, Berkeley, worked with public health officials in the southeast Indian states of Tamil Nadu and Andhra Pradesh to track the infection pathways and mortality rate of 575,071 individuals. Seriously. In the space of what? How many months? Who were exposed to 84,965 confirmed cases of SARS-CoV-2. It's the largest contact tracing study which is in the process of identifying people who came into contact with an infected person conducted in the world for any disease. The largest contact tracing study. So, we're dealing with a test that does not test specifically for SARS-CoV-2. It tests for coronavirus. This is the fact. Okay, look. See it from the CDC. Okay, see it from the CDC. So here we are. CDC, Centers for Disease Control and Prevention. What do your results mean? A positive test result shows you might have antibodies from an infection with the virus that causes COVID-19. However, there is a chance a positive result means you have antibodies from an infection with the virus from the same family of viruses called coronaviruses, such as the one that causes the common cold. Well, in fact, this whole thing reads the other way around. There is a chance that you might have COVID-19, but most likely you've probably got antibodies from other viruses within the coronavirus family, which do include the common cold and other strains of flu. Please, people, this is the fact of it, okay? So now we're looking at a study. You see, criminals reaping the profits of their crimes of producing a test for coronavirus and telling everybody that coronavirus means COVID-19, even writing it into a government bill. That lie, that medical lie, it's a lie. So, confirmed cases of coronavirus is actually all they can say, because this idea that there were 84,000 confirmed cases of SARS-CoV-2 is a total lie. It is the largest. So from this, first of all, so 575,000 people who were exposed. From that number, 84,965 are confirmed as carrying SARS-CoV-2. So it's not got a very high infection rate then, has it? It is the largest contact tracing study. So, lead researcher Ramanan Laxminarayan, a senior research scholar in PEI, said that the paper is the first large study to capture the extraordinary extent to which COVID-19 hinges on super spreading. Super spreading. Would you call, you know, less than 100,000 cases out of 575,000, would you call that a super spread? And based on a test that is not testing for SARS-CoV-2, that idea that these people were confirmed cases of SARS-CoV-2, that is a total lie, okay, because they cannot confirm, they can only confirm that they had a coronavirus. So apparently a small percentage of the infected population passes the virus on to more people. The researchers found that 71% of infected individuals did not infect any of their contacts, while a mere 8% of infected individuals accounted for 60% of new infections. How on earth could they have determined that? It is absolutely impossible. It's impossible. If they found that 71% of infected individuals did not infect any of their contacts, but a mere 8% of infected individuals accounted for 60% of new infections, I'm sorry, this is absolute BS. And we haven't got any evidence of it here. This is, sorry, this is absolute garbage. There is absolutely no way whatsoever that anybody can prove that somebody caught a virus off a particular individual. Recently in Britain there's been a case, it was in the newspapers, that a child had gone back to school, caught COVID-19, giving it to a dad who then died. And that poor child was all over the media. Oh, you know, she got COVID-19 at school and she went home and gave it to her dad. The child tested positive for a coronavirus, not for COVID-19. Her dad could have got coronavirus from anywhere. She could have been one of the people that, if she did have it, doesn't spread it. But everybody just assumed, well, you know, the daughter's tested positive, so obviously she's passed it on to dad. She's asymptomatic, being a child, and more or less, you know, at a 0.001% chance of dying from COVID-19. But daddy's caught it and daddy's died. Oh, if only you'd worn a mask inside the home, child. Absolutely despicable, disgusting, outrageous to put such a burden on a child on so little evidence. And the key word that they use here is potentially. 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 Okay, so all on the basis of potentially, we are to believe that children are actually super spreaders. All hinging on this word potentially. But, you know, we can forget that the vaccines are potentially deadly. We can forget that the vaccines potentially give people cancer. Well, actually, not just potentially, but have proven to do so in previous studies of just a couple of years ago. That potentially the re-edit might actually permanently damage people's DNA and even potentially damage the DNA of future generations. to the extent that we could at some point in the future be having to have genetic tests to see if to see if we'll be allowed to reproduce. Potentially. All of those things have a potential, but we can ignore the potential of all of that, can't we? But we can focus on the potential that children are super spreaders, and therefore it's very important they have the vaccine. But if the body's fighting off an illness, whether they've been genetically re-edited or not, they are at some point going to be carrying that pathogen, and therefore are capable of passing it on to people while their body is fighting it off. That obviously asymptomatic people are successfully fighting the virus off, so therefore they don't need their genes to be re-edited, do they, by AstraZeneca. This is just absolute outrageous, but that is what it is about. And this, research has found that the chances of a person with coronavirus, regardless of their age, passing it on to a close contact range from 2.6% in the community to 9% in the household. The research has found that children and young adults who made up 1/3 of COVID cases were especially key to transmitting the virus in resource-limited populations. This is it's just total nothing madness. And it's also, based on this study, 9% in the household. Oh, well, we're not going to be having lockdowns in the future, are we? They'll be coming in, oh, somebody's tested positive for the virus, right, that's it, You're not allowed to stay in your family home if there's other people in there. Kids are very efficient transmitters in this setting, which is something that hasn't been firmly established in previous studies. Well, I have not seen anything in this article to firmly establish it in this study, Mr. Laxminarian. We found that reported cases and deaths have been more concentrated in younger cohorts than we expected based on observations in higher income countries. I mean, unfortunately, child mortality rate in India it's very, very high. Standards of living, and they've obviously been studying poor communities, impoverished communities. And this idea that we can just base anything, any study whatsoever, on these ridiculous tests that might show an infection of COVID-19, but are more likely, there's only a chance, really, that the infection is going to be COVID-19. It is most likely that people who are testing positive are carrying the common cold. This is reality, you see. This is reality outside the BBC News and all the, and it's so serious that turns people's heads and makes them think, oh, well, it must be serious, everybody's talking about it. Oh, I don't believe in all these conspiracy theories. Look, I'm not a conspiracy theorist. I deal with facts, I look at the facts, I listen to what they're telling me. And we all need to do that. So this entire study is absolute nothingness, basically. It's just something, a piece of nothingness to support the narratives, isn't it? That, oh, there's a pandemic, children are super spreaders, oh yeah, so, you know, we're going to have to vaccinate them because otherwise they'll spread it. As if having a vaccination means that, you know, that pathogen's never going to hit you. The whole idea is that your body has learnt how to deal with the virus. But apparently, according to all studies done to date that we know of, the gene re-edit actually leaves the vaccine recipient more susceptible to things like cancer, more susceptible to other viruses. Because, you know, to re-edit means snipping out part of our immune system's DNA. So that means that our DNA forgets how to maybe fight cancer, how to fight other viruses, how to fight a mutated version of the virus we've been vaccinated against, that our body can't fight against it, so it kills us, that we actually suffer worse symptoms. All of these things are what have been the impacts of previous studies on gene editing vaccines until the last 8 months, when apparently suddenly they know exactly what they're doing. It's all perfectly legitimate. And we have this disgusting article here, published by the Mint. Testing on kids is next step on way to COVID-19 vaccine. And AstraZeneca plan to start testing their jab in 5 to 12-year-olds as schools and nurseries reopen in the UK. And this was in May. Okay. Bloomberg. That's where it's from. And they're talking about parents sending their children for these vaccines, and they give the example of some person called Carla Coletta who spoke to the journalist on the phone, saying that when she became a new mother in 2006, she was invited to enrol her baby daughter Caris in a vaccine trial for meningitis B. You know, and it left me wondering what kind of mother would actually enrol their child in a vaccine trial for meningitis B. When you become a mum, you suddenly become aware of your own mortality, and meningitis was on everyone's lips, Coletta, whose daughter is now 13, said in a telephone interview. I just thought, why would I not be interested in that? Why would I not want her to be vaccinated against that? I knew they had to start somewhere. Here, have my child. Now, either she is she's such an amazing person that she's prepared to put her own child at risk for the sake to help humanity, or is she just stupid? Coletta said that if her children were in the right age bracket, she would ask them if they wanted to participate in the COVID-19 vaccine trials. Personal gain and the greater good are the two most common reasons why parents participate. According to Shamez Ladhani, a paediatric infectious disease consultant at St George's Hospital in London and consultant epidemiologist for Public Health England. And while there are risks, adverse reactions are rare, so much so that they often don't get noticed until the vaccine goes on sale and is given to many more patients, Ladhani said. Some side effects you don't actually find out until you have given 100,000 doses. That's always a worry, said Ladhani, who is frequently involved in vaccine trials, but there isn't a clinical trial that's big enough that can pick that up. Well, it looks like we're going to have a big enough trial here in Britain because they're going to roll the vaccine out on 800,000 people. Because they want to test out their new biotechnology. They're literally like vampires. Oh, let us loose on the public. Let us loose on the public so we can perfect our gene editing techniques so that we can make rich people live forever and kill off billions of people, the useless eaters that Bill Gates and Prince Philip find so loathsome. So this whole article is about persuading people that, yeah, you know, go and vaccinate, put your children forward for experimental vaccines. When the vaccine comes out, see, it's been tested on children. The vaccine's been tested on children. So, you know, your children do need to be vaccines because they are super spreaders. And one thing is clear, they'll need a vaccine just like adults. And again, children appear to be less affected by COVID-19, though their role in transmission of the virus remains unclear. Okay, well, it looks like it's just been perfectly clarified. That's it. Vaccinate the children. Any species that can allow this, I tell you, if you can allow this and a mass vaccination of 7 billion people, including all billions of children, that species deserves to go extinct, just for the stupidity of that species, that they don't even care about the children, that they just would so casually hand them over to these half-wits. Bill Gates, a half-wit, as I've explained in my previous video. He's got a high IQ, but he's got absolutely no compassion, no empathy, no conscience, no heart, no soul. The man is a monster, literally. Because that's what a human being is, who has no connection to their conscience or compassion. That's what a human being is, a monster. Because like I've said, having a high IQ is only half the measure of intelligence. What about the other half? He obviously scores very, very low. The man has damaged and killed how many children in India with his experimental vaccines that his foundation got kicked out of India. That's a fact. It isn't. That's not fake news. He did get kicked out of India. And, you know, but here's India now with its study. You know, why have they done this study in India? Why didn't they do it in America? Didn't they have enough cases in New York? Nobody's really mentioned about the impacts of 9/11 on New York citizens' respiratory systems, and how in any flu season they suffered the worst every single year because their lungs are so badly damaged by the impacts of 9/11 and all the asbestos that everybody breathed in. You know, nobody's talking about that, why New York got hit so badly, whether it was with actual COVID-19 or other strains of flu, which can cause pneumonia and SARS-like symptoms, exactly the same, and would be registering as COVID-19 on their coronavirus tests, because apparently anybody testing positive for a coronavirus has COVID-19 is what they're working on. So we're just dealing with fraud upon fraud upon fraud upon fraud. and flimsy studies, flimsy analysis presented as fact, all to support what essentially is a false narrative, and does appear, the more I look at it, the more I absorb the evidence, it does appear to me to be the whole thing a cover just for killing people, experimenting on people, killing them. If they die, you know, nobody cares. Denying healthcare to people. And I've just had a study up here. You know, this is childhood cancer in the UK. Childhood Cancer Statistics England Annual Report 2018. And it's covering a study of child cancers between the years 2001 to 2015. So you're talking, you know, 15 years. 21,289. How many is that a year? British children. In 15 years. It's over 1,000 a year. It's definitely a lot more than the amount of children who've died or contracted, you know, more severe symptoms of COVID-19. They talk about survival rates for 5 years. They don't really go much into survival rates after 5 years. Because that's the most that they can really give you, is 5 years before the cancer comes back. It's really disturbing. And we don't have the figures for, you know, 2018, 2019, because the incidence of cancer have probably risen. But cancer is the epidemic that's killing people. Cancer kills a lot more people than flu. You know, COVID-19, as far as deaths are concerned, actually measures most closely with suicides. Cancer's the biggest killer. Well, one of the biggest killers. But there's no vaccine for cancer. There is no vaccine for cancer. And nobody's talking about a vaccine for cancer. Nobody's talking about cancer at all. We're just going to focus on COVID-19. Thousands of people in Britain have been denied cancer treatment, cancer screening. And other vital operations. People have died as a result, a direct result of lack of healthcare, lack of access to their GP. People have died. Far more people, actually, than COVID-19. There was an excess deaths outside of flu-like symptoms, COVID-19, in Britain during lockdowns. That's a fact. Doctors noticed it. And that's even with the deaths. Actually, the figures being totally fraudulent, because the vast majority of people who were claimed to have died of COVID-19, it turns out, only died with COVID-19. And again, did they really have COVID-19, or did they just test positive for a coronavirus? Well, we know the answer to that. they tested positive to a coronavirus, and it was assumed that they had COVID-19. You know, nobody's asking why are so many children getting cancer? Developing cancer. What is it about our lifestyles? The lifestyles that have been imposed upon us by the half-wits. And now the half-wits come to present us with one of their half-wit studies. And we should just believe it, because, you know, it's from Princeton University. America's been involved with it. All these top people, look, published in the journal Science. Princeton Environmental Institute and Johns Hopkins University and the University of California, Berkeley worked with public health officials. Oh, yes, of course we must accept it all, mustn't we? Well, no, we mustn't. We must be alert to the propaganda and read carefully. Potentially is as best as they could say. We're found to be potentially. And yet that warrants that. Super spreaders. Children key to spread. Evidence of super spreaders. Outrageous. Outrageous. Blatant propaganda. And that article from Bloomberg. And, you know, it's like I say, this level of attack, because that's what this is. It is an attack. It's an attack against our consciousness. To basically persuade us to believe what is not.